is your stem. Okay, so if you've read and understood, considering a history-taking station, please begin.
Hello,
Yeah, hello.
I'm Dr. Bashir, one of the surgical doctor here. Can I confirm your name and age, please?
Yeah, hi. Hi, doctor.
Can you confirm your name and age, please?
Yeah, I'm 33 years old and my name is uh, Ahmed.
Or is that okay to call you Mr. Ahmed?
Yeah, you can call me Ahmed. Yeah.
Yes, nice to meet you, Mr. Ahmed. Today I have been asked to ask you some questions regarding your condition. Is that okay with you?
Yeah, that's perfectly fine with me.
Okay. How can I help you today, Mr. Ahmed?
Yeah, so Dr. Bashir, I'm a gym trainer and
Okay.
I've been having this swelling in my groin region from about 8 months or so. And it's
Oh,
been slowly increasing in size. So,
oh, yes, I see that this is must be difficult for you. Could you please tell me when did it start?
yeah, so it started about 8 months back, and it was like in the beginning, I didn't notice it much, and then it started slowly growing.
Oh,
So I showed my GP then.
oh, I see that. I see that in your eyes. If there is it's become present all the time or just come and go?
When I lie down, I don't feel anything, but when I'm
Okay.
working and then when I'm moving around, I do feel,
Yes.
things sagging like that.
Yes. If there is any specific time during the day that lump increase in size?
Uh, I don't notice it when I'm going for my work, but once, after the day
Yes.
ends and all that, it's very
Okay.
ob yeah.
Could you tell me, Mr. Ahmed, is that lump painful?
Initially, there wasn't any pain, but nowadays, when I try to reduce that swelling, I feel it's a bit painful.
Oh, I'm really sorry. I'm really sorry for that. Would you like me to give you any painkiller?
Yeah, probably. That'll help me.
Okay. Please take it. And is the pain radiate to any area?
No, it's been in my groin region only. It's
Okay.
not going anywhere.
Okay. Is that pain uh, progressive?
Yeah, so as I told, 8 months back, there was not much of pain, and then
Yes.
slowly the pain has been increasing.
Yes. Um, could you please describe that pain for me? Is it colicky, cramping, or stabbing, or what?
It's pretty dull. It's pretty
Don't.
dull,
Okay.
and I don't,
Don't.
yeah, dull.
Okay. Don't. Okay. And if you had to rate that pain from 1 to 10, 10 being the worst, how would you rate it?
Maybe around 4.
Okay, I see that. And do you notice any straining in your passing urine or stool?
Doctor, I wanted to tell, I had urine tract infections in the past
Okay.
because as I'm gym trainer, I used to take a lot of
Yes.
tonics, and then
Yes.
I had a few infections, so I was treated by my GP for that.
Yes, I see that. And Do you have that lump increase in size when straining in urine or stool or in even cough?
Yeah, when I cough, I feel that it has become,
Yes,
I mean, I can feel it more better.
yes. Do you notice that lump decrease in size when lying flat?
Yes, doctor.
Okay.
When I, yeah,
And
in
do
morning,
you,
I don't feel
yes,
that anything.
yes, I see that. Do you notice any tummy bloating or tummy pain?
Not much.
Okay. Do you have any vomiting?
No, doctor, no vomiting as such.
Okay. Do you notice any, do you have any fever?
Not that I can remember of.
Okay. Do you notice any changing color or redness or hotness overlying the lump?
Lump, like it's the same color of the,
Okay.
the
Yes,
skin. Yeah.
that is good, very good. And do you have any discharge from lump?
No, doctor, that nothing of
Any
that.
any trauma or injection site to that lump?
No, no such no history, no trauma or something
Yes.
like that.
Do you feel the lump has a pulse?
I guess, doctor, it's you have to see that. I cannot feel
Yes.
anything like that.
Yes, we will do our best to see that. And would you please tell me if you have noticed any lump in your body?
Um, you mean anywhere else, doctor?
Yes, any lumps?
Eh, no, I not that I can notice of.
Okay. Unintentional weight loss or night sweating?
No, nothing of that.
Any decrease in appetite?
Okay,
No, I've
can
been.
you please summarize your history? Thank you.
Okay, I took history from Mr. Ahmad, 33 years old. Present with the 8 months history of the grown lump that increased in size when the patient uh, awake or standing, and the patient had straining in the urine, and also the patient is the gym trainer, and associated with pain that is dull in nature and not related to any side, and that is 4 in severity. And also patient not associated with any intentional weight loss or hotness or redness, and no pulsatile on the and no trauma to the sides. So my main diagnosis is the inguinal hernia, and also I have to consider that uh, femoral pseudoaneurysm, growing abscess, and the inguinal lymphadenopathy.
Okay. How would you confirm your diagnosis?
Yes, I will. First, I will do full clinical examination of the lump or abdominal examination.
First, you'll complete your history, then your examination. Yes, then.
Yes, I'll complete what I missed from history,
Yes.
the past medical history, family history, drug history, and social history, and idea, expectation, and concern. And also, I will go for abdominal ultrasound, chest X-ray, and the full blood count, urine electrolyte, inflammatory markers, and liver function test.
All right. What treatment can you offer this gentleman?
Yes, I will go for surgery because my main diagnosis is inguinal hernia, either open mesh repair or direct repair, or laparoscopic through that total extraperitoneal repair or transabdominal periperitoneal repair.
Oh, good. Can you tell me what are the constituents of stamina tonics which your patient normally takes or usually takes?
The stigmatonics,
Stamina tonics, yes.
really I don't know.
Yes, they contain steroids. Okay, what about your patient gave you the history that he suffers from genitourinary infections in the past? What would you do to rule that out?
Yes, urine analysis and HIV and and investigation about that.
What are GUM clinics?
This is the genitourinary clinic.
Genitourinary clinics, yes. So you will send the patient for the GUM clinics so
Okay.
that can be ruled out, because now that you're saying you want to do HIV, etc., but then
Yes.
you have to send the patient there, so that, and that is also part of the management. Not just you'll not just jump onto surgical management right away. You have to keep
Okay.
this in your mind as well. Since the
Okay.
patient is gym trainer, when do you think patient would be fit enough to come back to work?
Yes, between the 2 to 3 weeks.
Yes, after a procedure, after repair,
Yes,
hernia repair.
yes, after
Okay,
procedure.
right. What else can you advise the patient to keep in
Yes,
mind?
I will advise the patient to not heavy lifting,
Yes,
and also we retain the work from 2 to 3 weeks after operation, but
and
still don't have to heavy lifting, and the hernia, the lump will be could be recurrent after
could
even
repeat
after the
repair.
yes after even after the operation done
Okay, and straining as well for
and straining.
micturition or defecation. Good.
Okay,
Thank you.
thank you.